Welcome, everybody. Thanks for tuning into our talk. Today, we'd like to present to you about dentistry and medicine at the University of Sydney. My name is Abhishek Goyal. I'm a final year medical student at the University of Sydney, based at Westmead Hospital and Westmead Clinical School. Today, we've got quite a comprehensive talk about the Doctor of Medicine program at University of Sydney, which is a postgraduate medical course, as well as the double degree medicine program, double degree dentistry program, and Bachelor of Oral Health. It's my utmost pleasure to introduce you to Professor Jane Bleasel, Associate Professor Kevin Key, Dr. Jinlong Gao, and Dr. Delise Leadbeater, who are our academics presenting this talk. Professor Jane Bleasel is the Director of Sydney Medical Program and Director of Academic Education at the Sydney Medical School. She's also a professor of medicine and a staff specialist rheumatologist at Royal Prince Alfred Hospital. Associate Professor Kevin Key is a director of the double degree medicine program at the University of Sydney and a mentor for students such as myself who have gone through the double degree program. Besides this, he's a leader in the field of neuroscience, specializing in the neurobiology of pain. Dr. Jinlong Gao is a senior lecturer and research coordinator within the University of Sydney Dental School. He's also the academic coordinator and specifically for the double degree dentistry program, which he'll tell you all about today. Dr. Delise Leadbeater is the Director of Academic Education and Senior Lecturer at the University of Sydney Dental School. Amongst helping lead and develop our educational programs at the dental school, her research involves integrating dental and oral health students as partners of learning within teaching programs. So before I begin, I'd like to acknowledge the tradition of custodianship and the law of the country on which the University of Sydney campuses stand. We pay our respects to those who have cared for and continue to care for country. So as at the Faculty of Medicine and Health, as if you join this as a student next year, you'll be joining one of the fastest growing employment sectors in Australia. As we know with the current climate of COVID-19 and the pandemic, the area of medicine and health services is all the more salient in today's society. You'll be choosing from the largest range of health courses in Australia and graduate sought after and in demand with a University of Sydney bachelor's degree. At Sydney, you'll learn from experts, academics, and practicing clinicians with hands-on clinical training embedded throughout any degree that you choose to do here. So why choose University of Sydney to study medicine and health? Well, we have the broadest range of health degrees of any university, spanning medicine, allied health, and nursing, pharmacy, and many more. Each of our degrees consist of a research intensive, where you solve problems in healthcare alongside leading researchers and leading experts in your field. We have the largest network of clinical schools and industry partners in Australia, which I will talk about in a second. And we are top ranked in the world for a wide range of medicine and health subjects. As an example, as a medical student, I'm very proud to announce that in 2021, USyd was ranked 19th in the entire world for our medicine faculty. As well as this, we are ranked 13th in nursing, 28th in anatomy and physiology, 13th in pharmacy and pharmacology, and 3rd in sports-related subjects. So we are consistently ranked in the top 50 for a variety of medical and health-related professions in our university. As I mentioned, our industry partners span teaching hospitals, research institutes, and government organizations. As an example, I study at Westmead Hospital, and I also am on the wards every day at Westmead Hospital, which is the largest teaching hospital in Australia. Alongside this, we have partnerships with many other hospitals such as Royal Prince Alfred, Royal North Shore, Nepean Hospital, Concord Hospital, and many more. Besides this, we have partnerships with research institutes such as the Westmead Institute for Medical Research, the Chris O'Brien Lifehouse, the Brain and Mind Research Institute, all in Campbelltown, and many more. So in summary, we working or studying at the University of Sydney involves many extra components besides just studying a degree. You get all of these value-added parts to your degree, such as industry partnerships, opportunities for research, and placements in the real world medical specialty settings. So I'd like to introduce Professor Jen Bleasel, who will be talking to you about medicine at Sydney.
So welcome everybody. I'm the director of the medical program, as Abhishek mentioned, and it's my great pleasure to talk to you about the Doctor of Medicine at Sydney University. So Sydney Medical School is the oldest medical school in Australia. It was established in 1856. Abhishek's already mentioned that's one of the highest rated education and research institutions in Asia Pacific region. And it's internationally very competitive, one of the QS ratings, which is recognised as one of the highest ratings, and we are 19th in the world by the subject of medicine. What Sydney Medical School aims to do is to improve human health and welfare through our education, so our MD program, through research and the provision of healthcare. So a lot of your teachers that will teach you throughout the MD program are clinicians that are working in all those top class hospitals that Abhishek has already mentioned. We develop our graduates to be caring, clinically outstanding, and that's one of the things we're very proud of, research capable and globally aware, because we all live in this very connected society now right across the globe. And we want our students and our graduates to become leaders in medicine, public health, and also research. Our teaching hospitals are, you'll recognise, or anyone that lives in Sydney will recognise these hospitals. So Royal Prince Alfred Hospital, which is where I work, Royal North Shore, Concord, Westmead, which is a huge hospital now, the Children's Hospital at Westmead, Nepean, and we also have rural hospitals out at Orange, Dubbo, Lismore, and Broken Hill. And so you can do placements at those rural sites in the latter part of your degree. And we've also got we're very excited about our end-to-end program starting at Dubbo next year. There's also a lot of smaller satellite hospitals such as Ryde, Mona Vale, Katoomba, Manly, Hornsby, Balmain, Canterbury, Gosford, which are sort of scattered around these larger hub hospitals. The Doctor of Medicine, we've recently renewed and established a new Doctor of Medicine program, and it has 3 themes that run through it. The first is prepared for entry, and we have assumed knowledge in anatomy, physiology, and biology. Now, for students that have not done those subjects, we have an online foundational knowledge course that's available as soon as you enrol in the MD. And that covers all the assumed knowledge, it's interactive, and it has self-assessment. So we don't want to limit our applicants to the program, because we really value diversity. So you don't have to have a science degree, but we do have this assumed knowledge in those 3 subjects. The second theme is personalised pathways, and we have options throughout the 4 years to explore your personal interests, whether that's anatomy or imaging, or you want to be a paediatrician or an ophthalmologist. There are times when you can actually explore these throughout the program, which is not part of the core curriculum, but it gives you that opportunity to see whether you really do want to be an orthopaedic surgeon or an ophthalmologist. We have an MD project, which has a dedicated 14-week period, and we also have elective terms and vocational electives. So that's at the beginning and the end of year 4, where again, you can follow your interests. And finally, most importantly, the core theme is prepared for practice. So what we want our graduates to be ready to hit the road running when they become interns, so that they are ready to serve the community and become a really outstanding intern. So the last year of our program is a preparation for internship, where you're immersed with medicine, surgery, and community practice, and doing all the tasks that you'd be doing as an intern. So this is the structure of our MD program. So year 1 is foundation year, where you do biomedical science, and I'll show you in one of the diagrams what this looks like. It's around core blocks. Year 2, this is a really exciting change, where the students are now able to be 3 days a week on the wards and also in the community, so that really early clinical experience in the hospitals and also out in the community. Year 3 is research. That's the MD project for 14 weeks, and also specialty blocks, so pediatrics, psychiatry, critical care, and perinatal and women's health. That's obstetrics and gynecology. And then year 4, as I mentioned before, is our preparation for practice. And the core change in our MD program structure is earlier clinical exposure, and that last year is preparation for practice. I think it's important to emphasize that it is a 5-day-a-week full-time program. It's not like undergraduate courses where you might only have, 18, 20 hours of university. This is a full-time program. So our clinical teaching is a real highlight. So we have small group teaching. You start right from block 1, year 1 day a week in the clinical school, learning history taking and also examination skills. You also learn procedural skills, resuscitation, how to do vital signs, how to cannulate, how to take all sorts of different procedural things, how to put in catheters, anything you can think of that you need to be as a doctor. The year 2 I've already mentioned. We have earlier clinical experience in the hospitals and the community with guided experiential learning. So again, guided by both junior doctors and more senior doctors into how a ward works, how general practice works, and importantly, the transition between the hospital and the community. Year 3 I've mentioned is the specialty block attachments, and year 4 is the immersive attachments in medicine, surgery, and general practice. You can also, as I mentioned at the beginning when I was talking about the different sites where the clinical schools are, you can opt for 1 to 2 years of extended rural placements at either Lismore, Dubbo, Orange, or Broken Hill. We have 8 themes that run through the program. So basic and clinical science, clinical skills, diagnostics and therapy, research evidence and informatics, population health. We've introduced as a standalone theme, which runs both horizontally and vertically throughout the program, Indigenous health, ethics, law and professionalism, and interprofessional teamwork. Now, a course delivery is both, it's a mix, it's a blended course with both online short videos for content, and then importantly, interactive face-to-face small group tutorials for more active learning. And we also have obviously a mixture of lab sessions, anatomy, team-based learning, and the clinical tutorials that I've already mentioned. So this is what it looks like in more detail. So in year 1, the blocks you can see are based around systems. So musculoskeletal, I'm a rheumatologist, so obviously think that's really important, so it should come first. Respiratory, cardiovascular, endocrine, renal, SH, that's sexual health and reproduction, gastroenterology and neurology. So each of those weeks are based around a problem. So you really feel as though you can see the context of the biomedical science that you're learning, because it's all based around a problem. So for example, a heart attack or asthma, and all the physiology and anatomy and pharmacology is all based around that problem. Year 2 is bookended by those clinical blocks where you're spending time on the wards, ward-based learning, and also community learning supported by clinical tutorials, as well as case-based learning. Back to basics is a transition that we transition you between year 1 and year 3, where we introduce you to the lifespans. So an introduction to pediatrics and adolescent health, acute medicine, critical care, and also aging and psychiatry. There's then a hematology oncology block, which again is 3 days a week in the clinical schools, and the block 4 is the same as block 1, where 3 days a week in the clinical schools. I've already mentioned the details of year 3 with the specialty blocks, and then the MD project, which is 14 weeks, and then year 4 with that elective and the selective. Now, for any international students that may be on this webinar, those are potential times where you can go back to your, do some clinical work in your home country, so that you can get some sort of references for potentially applying for jobs back home. And there's also the option of doing either medicine or surgery back in your home country. Obviously not an issue at the moment, but I certainly hope by the time that you would be in year 4, we will be back to normal travel. So the online foundational knowledge course, as I said, it covers all the knowledge that you need if you haven't done physiology or anatomy or biology. So when it comes to, if you're offered a place and it comes to enroll as soon as you can so you can get access to this, particularly if you're a non-science student, so that you can make sure that you have that, that assumed knowledge ready to start the MD program. Next slide. MD research, so we teach research methods in year 2 in that back to basics block, and then the research topics, you're offered a range of different research topics, and you can preference what you want to do your research in, and then you get ready for that to start your dedicated research project in year 3. And there's also the option to extend your research into the elective term, which is at the beginning of year 4. So you really have a long period of time. If you're really interested in research, you can do both the MD project, which is 3 months, and then another 2 months in your elective period. Next slide, please. We have lots of options for research. We're surrounded by research excellence and research centres. So, you know, the important topics of cancer, cardiovascular disease, neuroscience, infectious disease, great Children's Hospital at Westmead and the associated research that goes on at that place, drug discovery, bioengineering, biotechnology, a huge public health department in the university, and bioinformatics and data science. So really any area you can think of, there are options to do research. And we are one of the world's top research universities, second in the world for research impact, and that's as rated by the Times Higher Education in 2020. Thanks, next slide. So that's a summary of the MD program. You know, we're really excited about our new program, and if you want early clinical experience, this is the program for you. Thanks. I'll hand on to Kevin Key, who will speak about the double degree medicine program.
Jane, thank you very much. I think everyone has to agree that it's a pretty amazing course that we're offering here, and clearly gold standard in every dimension. So my name is Kevin Key, and as Abhishek very generously said, I am the lead for neuroscience in the School of Medical Sciences, but also the coordinator for the double degree medicine program. So I'm going to talk to you now about ways in which you can enter into the wonderful MD program that Professor Bleasel's just spoken about. So there are 2 pathways to enter our MD medical program at the University of Sydney. And the one that I want to focus on today is the one that's illustrated in the top line of this figure here. And this is the double degree program, in which you gain entry from high school to one of our undergraduate programs, either a Bachelor of Science or a Bachelor of Arts, and then transition seamlessly into the MD program. Now, I just want to remind you that this is not the only way of getting into the medical program at the University of Sydney. The most common way, and the largest number of students that enter our MD program, enter via the route that's shown below. And this is that you complete a bachelor's degree, and towards the end of your 3rd year sit an entrance examination, the GAMSAT exam, and also there may be additional assessments. At the moment, we're not running interviews due to COVID, and the pathway into medicine requires you to have scored a GPA of 5. That means you've maintained a credit average of 5 in your undergraduate program, and then met minimum criteria for consideration in your GAMSAT, and then we would look at you as a potential entrant into our MD program. But what I'd like to focus on this morning is the pathway shown at the top, and that is a possible entry pathway from high school, as long as you reach an ATAR of 99.95. So if you're a high achieving student and you reach an ATAR of 99.95, or the equivalent in IB, which is 45 plus, then you may be considered following an assessment day for entry into one of our bachelor's degrees and a seamless entry into the MD. So this is a 7-year intercalated program where you take a bachelor's degree at the university and then follow on with an MD. So as I said, to be eligible, and if you're applying through UAC, to be eligible for consideration for this degree program, this special degree program, you must have one of the double degree medicine programs in your UAC preferences. So when you're filling out your UAC form, make sure that our degree codes for these double degree programs are one of your nominated preferences. And if you do that and you achieve the required ATAR or its equivalent, so the ATAR that we're looking for our domestic applicants is an ATAR of 99.95. If you're applying as an international applicant, then we also require you to have an ATAR equivalent of 99.95. And if we have any First Nations applicants, we would consider an application from any Aboriginal, Australian and Torres Strait Islander student with an ATAR of 90. So we will consider an application with this slightly lower ATAR. In addition to meeting these ATAR requirements, all domestic applicants must also attend our assessment day. And our assessment day comprises of a written assessment and a group discussion. And if you're successful in that assessment day and your ATAR meets those criteria, then you'll be eligible to be made an offer for our double degree stream. I should also note at this point that we do have an E12 access scheme, and if you consult the university website, you can find the details of E12 application process. So as I said, this is a small intake into our MD program. We have up to 30 domestic places available each year and up to 10 international places each year. And just to remind you again that by far the majority of our MD students enter through the graduate entry pathway, and this is a smaller, more bespoke entry pathway direct from high school. So what does this degree structure look like? So in the first 3 years, you will take a Bachelor of Science or a Bachelor of Arts, and you need to meet the degree requirements of each of those degree streams. And you can find the regulations for the Bachelor of Science and the Bachelor of Arts on the university website. In addition, we require that you maintain an average mark during your degree of a credit average during the entirety of your degree. So we mean each year, in each year of your degree, you have to get an annual average mark of 65 or above. So in order to maintain your place in the MD program whilst you're in this double degree program, you must meet a 65 mark average each year. In addition to that, we also ask that you take a unit of study called SMTP 3007. And this is an elective placement unit combined with a series of personal and professional development activities during the 3 years of your undergraduate program. And you must satisfactorily complete both the elective and the personal and professional development activities in order to maintain your place in the MD in the future. And the final requirement that we put on you during your undergraduate program is that you meet the assumed knowledge that Professor Bleasel talked to you about. So you must include in your degree planning 18 credit points. That means 3 units of study, 1 in human biology, 1 in anatomy, and 1 in physiology. And successful completion of those 18 credit points means that you will meet the requirements of assumed knowledge for the MD program. So as long as you meet the degree requirements, the credit average mark, you complete your elective unit, and you do your assumed knowledge units, then you'll be guaranteed a Commonwealth supported place in our MD program. So important, the dates that you need to note in your diary. As you will all be aware, there have been a number of changes in the HSC and ATAR release dates. Applicants who are interested in this program, can I stress really strongly that keep checking our website with the greatest of regularity, okay? Things are changing quite rapidly during these days, and our timelines will be populated into our website very soon, and keep checking back to make sure that there are no changes. All applicants will be expected to attend an assessment day, and the assessment days will be in January once the results are released. Please ensure that if you're interested in this course that you've added either a BA MD or a Bachelor of Science MD as one of your preferences prior to this assessment day. Now, it's really critical. These assessment dates are not negotiable. And if you're eligible, you must attend on the first assessment day after the release of your ATAR or other secondary qualification results. I'm guessing in these days, most of us, at least in New South Wales and Victoria, are unlikely to be travelling at the time of these assessment days. So you'll be likely very available and possibly not on holiday. But please, please, can I stress really strongly, if you're interested in our programs, check our website regularly, and as soon as the dates are released, pop them into your diary and make sure that you've added us as a preference on your UAC form. So you're thinking of taking a Bachelor of Science. Well, the University of Sydney underwent a massive curriculum reform a couple of years ago. And this means now that you can major in an enormous number of units of study and an enormous number of majors within the structure of the Bachelor of Science. You can take things ranging from geography, agriculture, ecology, evolutionary biology, the classic medical sciences, food science, psychology, financial studies, maths, a whole range of different degree subjects. And we encourage you, as Professor Bleasel said, to take a degree that really speaks to you, that you will really be successful in, and one which perhaps embraces your favorite subjects at the moment, but perhaps when you step into your MD program, you're going to have to say farewell to. So this is an opportunity for you to really enjoy something that you enjoy, or perhaps even pick up something new. Perhaps you've often thought that you might like to study something that hasn't been available at your particular high school. And this is now your opportunity to take a novel subject and really indulge yourself in scholarship in a new area. And similarly, if you're interested in the Bachelor of Arts, there are a whole range of majors that you can take, from language studies, cultural studies, business, anthropology, archaeology, history, English, film studies, theatre, international relations, a vast array of majors that you can take. And again, if you're deciding to take the BA MD stream, we recommend that you take something that you will thrive in, something you will be successful in, or perhaps something that you've always wanted to do. And this is the opportunity before you step into the world of medicine to take a subject that will really extend and broaden your horizons. In addition to the major, for example, if you're taking the Bachelor of Science and you decide to take a major in one of the fields of medical science, for example, you might decide you want to do a major in physiology. This doesn't stop you from taking a minor subject in the field of arts. So you can maintain a sort of diverse coverage of interest during your undergraduate program. So for example, if you're taking a Bachelor of Science, it's perfectly possible to take a minor from units in the Faculty of Arts and Social Sciences that appear in our shared pool of units. And similarly, if you take the Bachelor of Arts and majoring in one of our arts majors, you can also take a science subject as a minor. So for example, you might want to take Spanish studies, but take your second major in immunology. All this is possible through the new degree structures that resulted from our curriculum reforms of a few years ago. So our encouragement is to take subjects that you will love, that you will succeed in, take subjects that will expand your vision, expand your horizons, and set you up for the lifelong learning that is expected from the MD program. Because when you take medicine, it's not just the end of study when you graduate as a doctor. You'll be very sure that this is just the beginning of study. This is a career of lifelong learning. Thank you. And I'd now like to hand over to Dr. Jinlong Gao from the Sydney Dental School. Jinlong.
Thank you, Kevin. Hello, everyone. My name is Jinlong Gao. I'm the academic coordinator of the MD admissions and also coordinator of double degree dentistry program at Sydney Dental School. Now I'm going to change the gear and talk about dentistry. Next slide, please. Sydney Dental School is the first dental school in Australia till today for over 120 years. we have provided successful education and training in dentistry and oral health. So Sydney Dental School is one of the largest dental schools in Oceania region. We provide our students the facility, simulation facility, and also clinical training in two main teaching hospitals, Sydney Dental Hospital and the Westmead Center for Oral Health. Being based primarily within public hospitals allows our students to be exposed to both local and internationally recognized scientific and professional communities. And more important, allow our students to see patients from diverse culture and ethnic backgrounds with lots of challenging oral health issues. Besides these two public dental hospitals, our students also have the opportunity to take clinical placement in other local health districts across Greater Sydney, and also in collaboration with Australia's largest branded private dental network, Pacific Smiles Dentistry. We provide our students the opportunity to treat private patients in private dental practice environments. Next slide, please. Dentistry is a branch of healthcare devoted to maintaining the health of teeth, gums, and other tissues within and also around the mouth. As a profession, dentistry has different divisions based on the scope of practice, including general dentist, oral health therapist, dental specialist, etc. Immediately after graduating with a dental degree, such as Doctor of Dental Medicine or DMD, you'll be able to register and practice as a dentist immediately. And the general dentist can provide general dental services to all ages patients. So graduates of Bachelor of Oral Health will be able to register as an oral health therapist, which is a combined qualification in dental therapy and dental hygiene, who can provide limited dental services with a focus on prevention and oral health promotion. Dental specialists are dentists who have completed 3 years specialized training and education program, plus at least 2 years of general dental practice experience. Then you'll be specialized in certain areas in dentistry. So a dentist is a health professional dedicated to the highest standards of well-being through prevention, diagnosis, treatment of oral disease and conditions. For example, dental caries or tooth decay and the periodontal disease or gum disease are still among the most prevalent chronic conditions affecting the Australian population today. So the demand of dentists is still very high in our community. In addition, dentists also plays a critical role in the early detection of other systemic conditions of the body, which has manifested themselves in the oral cavity. So studying dentistry is intellectually challenging, as the core element or component of dentistry is based on the mastery of complex biology and the body of knowledge and skills. Studying dentistry is also technically challenging. So in order to perform dental procedures, a dentist must be able to use your hands in a very skillful and coordinated way to work within precision on very contained in extremely small scale. Despite those challenges, dentistry offers a unique blend of positive elements, in my opinion, such as helping people and treat patient disease, combining art and science in the clinical practice, having lifelong relationship with your patients and your colleagues, good job security, and good regular working hours. And also you can be self-employed and financially independent. So there's nothing more rewarding and satisfying than admiring a completed and a confident smile makeover you have done for your own patients. Next slide, please. So general dentists are trained to do all different types of work and the procedures they are comfortable performing. The exact procedures performed by general dentists are up to the discretion of the particular dentist. So general dentists are also lifelong learners, and they can attend continuing professional development programs and courses to broaden their practice skills and their knowledge, increase their scope of practice procedures, such as place implant, treat orthodontic patient, etc. Next slide, please.
Oh, sorry, 1 second.
Yeah, that's all right. Yeah, that's the correct one.
Okay.
Medicine is a postgraduate degree, so it's a 4 years length postgraduate degree. Because the DMD is a postgraduate degree, so it requires applicants to have the bachelor degree first. Majority of our dental students enter the DMD program through the postgraduate pathway as shown in the lower panel on this slide, which requires applicants successfully complete an undergraduate study in any area, including Bachelor of Oral Health, Bachelor of Science, Health, etc. And also, after achieve the first degree, then the student applicants need to be competitive, get a competitive result in an admissions test. For the domestic applicant, you must apply with a valid GAMSAT admissions test result for DMD. For recent high school leavers, probably most of our audience today, you will be eligible for this situation, and you need to apply, you can consider the double degree dentistry program, and you need to have an exceptional ATA, like 99.6 and above, and you can consider this program and show at the top panel of this slide. So this is a combined 7 years program between Bachelor of Science and Doctor of Dental Medicine. And once you enter this program and meet the progression criteria, you will have the guarantee DMD position, CSP positions when you move to progress to DMD 3 years later after you complete the first degree. Please note that the double degree dentistry also has a very limited quota. The current quota for double degree dentistry for 2022 intake is only about 15. Next slide, please. So to be eligible for double degree dentistry, as I just mentioned, you need to get a very competitive ATA, like 99.6 and above. You also need to have the math prerequisite, and in addition, you're expected to achieve satisfactory performance in an online assessment process. The online assessment includes a written component and a panel discussion. Please note that we also have facilitated pathways for eligible applicants, including the GADGO pathway for First Nations applicants, and also E12 schemes for disadvantaged applicants. So adjusted ATA will be applied to those pathways. Please refer to our university webpage or contact the university directly for eligibility criteria. Next slide, please. So once you enter the DMD program, what are you going to study and what are you going to learn? So during the first 2 years, you will spend most of your time in the main campus and Sydney Dental Hospital. The oral biosciences and tailored biomedical science course in year 1, 2 will lay the solid foundation for your future clinical studies. Our program is featured with early preclinical and clinical exposure. You will start learning clinical skills in the simulation environment from the first week of year 1. Your patient clinic will start from year 2, and you will be trained to interview a patient, take patient history, assist senior year dental student as a dental assistant. You will also learn how to conduct research activities and start your research project to explore the unknowns in dentistry since year 1. Next slide, please. So when you progress to year 3 and 4, you will spend most of your study time in the integrated patient clinics in both public and private sectors. You'll be supervised to provide comprehensive treatment to the patients. So students will be mentored by our experienced clinicians. Through the regular meeting and case discussions, you will learn diagnostic treatment skills as well as patient management and communication skills. You also have the opportunity to rotate in various specialist clinics, and also to prepare our students and graduates well-rounded for the current practice and for the modern practice. We also provide intensive course in fixed prosthodontics, implantology, and orthodontics, etc. In addition, our program provides you more opportunity to enrich your experience in dentistry during year 3 and year 4. You'll be invited to take about 2 month rural placement and also practice in rural and regional New South Wales. And you can also take the dental electives to even seek international placement opportunities. Next slide, please. So dentistry is a fast evolving industry driven by advances in technology, emergence of new dental materials, and also increased demand of complicated dental work with our aging population. So our program is featured with integrated curriculum using multidisciplinary approaches. Can you click one more time? Thank you. Using multidisciplinary approaches to teach our students tackle the real world problems and issues. As part of the Faculty of Medicine and Health, our students have more opportunities to access interdisciplinary learning experience and also cross-disciplinary collaborations. So we aim to prepare our graduates ready not only for the current workforce, but also for the future market. Next slide, please. Sydney Dental School offers the most comprehensive educational programs in dentistry to train across the whole oral health team, including general dentists, dental specialists, oral health therapists, public health dentists, as well as dental academic and researchers. So we are able to pave your professional career path and help you achieve your career aspiration. Next slide, please. If you want to become a dentist, and if you are considering double degree dentistry for your future study, I would like to highlight some key information about application and admissions for the 2022 entry for double degree dentistry. As Professor Kim mentioned, due to the current COVID outbreak, which impacts the HSC exam and also ATAR release, we are currently reviewing selection dates and admission processes to make sure the selection process is fair and equitable for all applicants for 2022 entry. Please check website regularly for any updates and any potential changes. Please note that the assessment dates are not negotiable, and eligible candidates must attend the first assessment day after release for ATAR results. In order to secure the place to attend the assessment, please make sure you put the BSc and DMD as a preference prior to the assessment day on the UAC. So that will lead to the end of my talk, and I wish the best of luck for your HSC and also your future endeavors. Now I would like to hand over to Dr. Peter for the Bachelor of Oral Health talk. Thank you.
Thank you very much. Thank you, Jinlong. Next slide, please. I'm going to briefly take you through some of the criteria that we're using for admission into the Bachelor of Oral Health program. Now, this is a 3-year full-time undergraduate program, and most of our students come to us as school leavers. For 2022 intake, the minimum ATAR entry is 83, and there's also an interview that's required in this process. The interview is held before the ATAR release, so if you're interested in applying for the interview, please go onto the website and make an application for the interview as soon as you can. Bachelor of Oral Health graduates are registerable as dental practitioners, as oral health therapists in Australia and New Zealand. And our course offers a range of diverse teaching methods, I guess broken into 2 main types of teaching approaches. So there's lectures and tutorials where you're learning about the theoretical aspects of your program, as well as simulated clinical practice and clinical practice. Next slide, please. So this is a visual of how you progress through the 3 years of the program. The first year is spent understanding some of the key foundational knowledge and also beginning to learn some of the procedural skills that are required for the practice of oral health therapy. When you embark in second year, this is an exciting time where you start to see your first patients in both the practices of dental hygiene and child and adult patients in the practices of restorative dentistry. And in year 3, 4 out of your 5 days is spent doing clinical placements. This is in a variety of community settings, hospital settings, as well as in rural and regional placement sites. One of the key features of the program at Sydney is the emphasis on health promotion and the program in Oral Health and Society that this program offers for our students. Next slide, please. This slide is just really to, I guess, answer those questions which some of you might have about, well, how is it oral health therapist different to a dentist? Oral health therapists perform a range of clinical procedures and patient care, particularly in the areas of periodontal assessment, periodontal treatment, as well as some basic restorative care for both child and adult patients, as well as the extraction of primary teeth, some orthodontic procedures, as well as for the administration of local anaesthetics. Next slide, please. So this infographic provides an understanding about some of the interrelations between some of the programs that are offered in the School of Dentistry. So the Bachelor of Oral Health graduates are welcome to apply into the Doctor of Dental Medicine program. And as Dr. Gao mentioned, there's a number of other programs that the Sydney Dental School offers in specialisations, both in clinical specialisations and in dental public health. So all the best for your HSC and further studies. And I'll now pass you back to our student ambassador.
Thank you, everybody, for your talks. I'm sure all of the students or the talks have answered quite a lot of the questions that the students had. We have a little bit of time now for a little bit of Q&A, approximately 10 or so minutes. I know there are quite a lot of questions in the chat, and I will try to do our best to answer as many of them as we can. However, we know that we're not going to be able to answer everything. I would like to, later on, we'll add a link to the Dentistry and Medicine Course Advice Center, which is another Zoom link that'll be live after this talk. We'd encourage you to go there if your question hasn't been answered, and you'll be able to chat to academics and student ambassadors like myself to see if you can answer your question. Alongside that, if your question isn't answered, we'll do our best after today to reply to your questions via email or make an information sort of document that we can distribute around to answer any of your questions. In the meantime, please have a look at our website for more details and see if that answers your questions as well. So I'd like to pose a few questions to the academics, and if anybody would like to answer based on their expertise. So one person has asked, for the double degree dentistry and medicine degrees, is a UCAT required?
No, we don't require UCAT for double degree. We simply require an ATAR of the threshold measure 99.95 for the MD program and attendance at the assessment day.
One question we've received a lot of today is around assessment day. Can you tell us a little bit what students can expect on the day if they're chosen to attend for both dentistry and medicine?
I'll comment first on the MD, double degree MD, and then perhaps Jin Long can answer the dentistry question. So our assessment day will be held online as it was last year, and that was done very successfully. The assessment day requires you to attend in person, and you will interact with students who are in the program currently, as well as academic staff involved in the program. You will be asked to perform a written assessment, which will be a series of questions. And this is an assessment that you can't prepare for. So it's not a knowledge-based assessment. And the second part of the assessment is a group discussion, and the discussion is conducted with a faculty member and a member of the current cohort of students, and taking together the outcomes of both the written assessment and the group discussion. Candidates are ranked and offers are made according to the highest ranked students in each session. Jin Long.
Thank you, Kevin. For double degree dentistry is very similar to double degree medicine, and currently we don't have the absolute date for the interview at this stage due to the postponement of the HSC. So as we always emphasize, please frequently view our website for any updates. And for the selection process, similarly, we have two components, and written component as well as panel discussion, and conducting very similar format with double degree medicine. Thank you.
And Delise, for the MMI, we've also had a few questions from what students can expect when they do the MMI for oral health.
Thank you. The oral health MMI process is a circuit where you will be having a one-on-one conversation with several assessors And the sorts of things that you'll be grappling with are scenario-based questions where you need to provide some kind of response, what issues arise for you, what actions you will be thinking about taking. So it's really trying to help us understand how you approach various scenarios that potentially cause dilemmas in everyday life and potentially related to the practice of oral health therapy.
Okay, thank you. Another question we've received is around for the Doctor of Medicine, Kevin. After the Doctor of Medicine, what can you do? Are you immediately a doctor and can you treat patients? And how do you specialise?
I think I'd like to hand this over to Jane because it's a really question about clinical training.
Sorry, what? Just repeat the question.
Can you work as a doctor straight after you finish?
Oh yeah, yep.
How do you specialise?
When you graduate from the MD, you are guaranteed a place as an intern in one of the hospitals around New South Wales. Now, that doesn't apply, unfortunately, to international students. We can't guarantee international students a place as an internship, but most of them actually do eventually get a place. But if you are a local person and you finish the MD program, you're guaranteed an internship in one of the New South Wales hospitals. Now, you then do, and as soon as you graduate, you're paid, and you're paid quite well. So you do 2 years of postgraduate year 1, postgraduate year 2, and that's just doing general rotations through the hospital, surgery, medicine, emergency, you might do cardiology, things like that. And then you can, if you want to specialise in surgery or medicine, you need to do further study. And normally you do an exam round about the postgraduate year 4. So you've been working in a hospital for about 3 or 4 years. Then you do another exam and then you can specialise. And you can specialise in a medical specialty or a surgical specialty or dermatology or radiology. So it's a long haul. I mean, I'm a rheumatologist, and I think it took me about, counting a PhD, probably, I don't know, 15 years of study. That's in counting a PhD, but and some time overseas. But the whole time, you're being paid, and it's fascinating work. So whenever anyone says to me, what do you need to do medicine? I say you have to need to really like learning and studying.
Well, that relates to the last question I'll ask. What can students expect in the first year in terms of study load? What does that look like?
I think Abhishek should answer that.
Yeah, I can answer that. So the medical program that I did was slightly different to the updated program, but in general, it is considered a full-time program. And so you are expected to be studying or sort of learning the whole week. In saying that, there are obviously, it is flexible enough that like a lot of people do generally are able to find time to do other things such as work if they want to, or pursue other extracurricular activities. In general, my first year, for example, I'm not sure if this is exactly the same as the current program. It looked like 1 day of clinical. So I was at the hospital 1 day a week, and then I would have 3 days a week of lectures, tutorials, group sessions of study, and then 1 day of independent study. So in general, it is a full-time program. And so it's quite intensive, and it is expected that you do the program full-time, and there's no option to do part-time study. And it is a little bit longer than the general UCID semester, like the semester 1 and semester 2. So medicine works outside of the general like semester 1 and 2 based program at the University of Sydney. You do get breaks in between each block. So for example, between cardiovascular or respiratory block, you do have small breaks in between. So it's not like you have those similar, like your breaks might not necessarily align with everybody else in the university, but you do get breaks. But in general, yes, it's a long-winded answer, but the point is, yes, you do get a full-time sort of load, but it is very doable.
Thank you so much, Abhishek. Now, there are a lot of questions. I'd please encourage everybody to go directly to the Course Advice Centre and ask those questions. We place the link in the chat. Thanks so much to our panel and for all our guests who are attending today.
Thank you, everybody. I will we have the chat. In the chat, there is the Zoom link, as Erica mentioned. So please go to the Course Advice Center, which is that Zoom link, if your question hasn't been answered or if you have more questions. I will unfortunately have to close this webinar as we are expecting another webinar in a second. So thanks everybody for tuning in, and I hope this was informative. If you want this this course advice link, it's also on the Open Day website as well. So if I close the chat, close the webinar before you're able to find it, then you can find it on the website. Thanks everybody.